If you can feel lower back pain just from touching your lower back, or it's just a slight pain but feels uncomfortable and you want that pain to be relieved instantly, you're in the right place. In this video, we will reveal what one of the most common causes of lower back pain is, how to relieve the pain, and how to prevent the pain in the long term. The lower back pain we're talking about is the type of pain you can feel by just pressing on it with your finger. If you put your finger on it, it can cause shooting pains down to your butt, and there is definitely something you can do about it. First of all, you need to identify where the pain is coming from. One of the most common causes of lower back pain is the glute medius, which sits between the glute maximus and the glute minimus. The glute medius is a problem for people with lower back pain and is caused from hours of sitting, bad form in the gym, neglecting muscle strengthening exercises, or an inactive lifestyle. The glute medius muscle is used to stabilize our pelvis when we stand, walk, or run. It helps keep the hip in a neutral and balanced position. The glute medius is the prime mover of abduction at the hip joint and medial rotation of the hip. If you have a weak glute medius, you will drop your hip whenever you move your left or right leg, up or forward. Initially, you won't feel any pain, but the pressure placed on your glute medius will be distributed to the surrounding muscles and can cause lower back pain. To determine if you have a weak glute medius, you can try the Trendelenburg test. Stand on one leg for 30 seconds and keep your pelvis level. Make sure your knee is at least a 45-degree angle. This tests the strength of your hips. If you can keep your hips level while your knee is raised, you do not have a weak glute medius. And if your hips are not level, meaning it falls to one side, you do have a weak glute medius muscle. Just before we get into some of the best stretches to relieve lower back pain, make sure to hit that subscribe button and turn on notifications so you never miss a video like this. The first stretch to relieve lower back pain is by using a roller or a foam roller. You place the roller on the lower part of your back, lower your back onto the roller, and put your body weight into the stretch. Try to relax as much as possible and focus on your breathing to allow your muscles to relax. Do this for 30 seconds if you can, or whenever you feel like you need a break, and then repeat 5 times. If you want to take this further, you can put your feet against the door, and that should create more pressure, which will decompress your spine further. To target specific areas, you can wrap a soup can in a towel to really target specific areas. The second stretch you can do to reduce lower back pain is the cobra pose. This can help with lower back pain or sciatica. The cobra pose is where you lie flat face down and push your hands against the floor so the top half of your body comes up and you get a stretch in your lower back. Hold the stretch for 30 seconds and then repeat 5 times. To further this stretch, you can put a towel around your waist and grab each end of the towel with your hands as you come up from the cobra pose. You can pull each end of the towel forward to stretch your back even further. Again, hold this for 30 seconds and repeat 5 times. You can also move the towel around to target different areas of your back. You can choose to do a half or a full cobra, whichever you feel most comfortable with. The third stretch you can do is the child's pose. To start child pose, get onto all fours and sit back onto your heels. Keep your knees together and stretch your arms forward so you can feel a stretch in your arms, back and quads. Try to stretch as far as you can so you can feel the best stretch and the most relief. Remember to breathe deeply to relax your muscles and hold for 30 seconds or as long as you feel comfortable and repeat 5 times. The child's pose elongates the spine and reduces stress on your lower back muscles. These stretches all help with lower back pain but may only help you short term. If you're looking to do something that lasts for the long term, it is best to strengthen the glute medius muscle to lower the chances of getting lower back pain. The first exercise to strengthen your glute medius is lateral banded walks. To do this, you will need to put a resistance band around your knees, squat down slightly and maintain a straight spine. Sidestep as far as you can against the resistance band to the right and then bring your left leg towards your right so that the band is still firm. Then repeat for 12 to 15 reps and switch to your other leg. Repeat this for 3 to 5 sets. Remember, when you are doing this exercise, do not tilt your hips because it can lead to a poor posture, which leads to further lower back pain. The second exercise to strengthen your glute medius is side lateral leg raises. Lie down on your right side on the mat or floor. You should keep your body in a straight line with your left foot on top of your right. As you exhale, raise your leg off the lower leg. You should feel the muscles flex in your lower back and obliques. Then inhale as you bring your leg back down and repeat for 10 to 12 reps and switch to the other side. Do this for 3 to 5 sets. When you're doing this exercise, it is best to keep your core tight, as this relieves the pressure on your lower back. This primarily targets the glute minimus and glute medius, which decreases the chances of getting lower back pain. The third and final exercise to strengthen your glute medius is the knee to chest exercise. To do this exercise, lie on your back on the floor or mat and raise one knee up enough so you can hold one leg with both of your hands. Interweave your fingers together to hold your knee to your chest. Hold for 15 to 30 seconds and then switch to your other leg. You can do this for 3 to 5 sets. Remember to do these exercises 4 to 5 times per week or even every day if you struggle with lower back pain. These are, in my opinion, the simplest and best ways to strengthen your glute medius muscle with almost no equipment. We have a bonus tip for relieving back pain, and that is your sleeping position. The ideal sleeping position to avoid back pain is sleeping flat on your back. Many people find it difficult to sleep in the position, but it is optimal for spine alignment. The second best sleeping position is on your side. This is also a good position for people who snore because it keeps your airways clear so you can breathe properly. The reason this isn't the best sleeping position is because while you're asleep, you have a higher chance of twisting your back and misaligning your spine. To prevent this, you can tuck a pillow between your legs to keep your spine in a neutral alignment. The worst sleeping position is lying on your stomach. This is because this puts the most pressure on your spine muscles and joints, and it flattens the natural curve of your spine and can cause neck and upper back pain. Another way to naturally decompress your back to relieve pain is by hanging. And if you want to know more about this, check out this playlist right here. And if you haven't already, make sure to hit that subscribe button, and I'll see you in the next one.